Okay, so today is the 27th of April, Comprehensive Neurology. So we are doing a video presentation of long-term epilepsy monitoring. How is the best in my experience and my knowledge of doing it. So let me show you. Dr. Drakon kindly expressed interest to be a patient today. So let's do it. So I'm not gonna emphasize today that like 10 20 technique and everything, assuming everyone knows. So I'm just gonna start to prep the head. The only thing which I want to notice, this is like a lemon prep, the one which I like to use for the study because it's more the grids has a larger size. They're more easy just to use and save the time basically. So let me start to work. So I found my landmarks and I'm gonna start to prep the head. So different techniques I use, like kind of stroke techniques. Some people like to use like techniques like clockwise or otherwise. So it doesn't really matter as long as you prep the head. That all it counts.
And so this preparation is from this paste?
No, this is like exfoliation cream. Exfoliation. Okay. It exfoliates the skin and reduce impedance. So that way the connection is gonna be good and it's gonna be like a good quality study.
Okay.
So
are there other types of preps?
Yes, there are like you use like a new prep, and another one which I like is a Neon Cotton brand. The three best on the market from my knowledge. Each of them has some specs, but it doesn't really matter. So you basically you always typically ask patients if the patient has some skin issues, allergy reactions, outbursts, or any kind of things when they take a shower, and we put like we not put on the earlobe because it's not gonna stay longer. We put it like on a mastoid area here, so we prep this area well. So let's do the forehead. So here, if you remember, there's just 5% from this way to this way. The rest are like 10% on the circumference measurement. So a lot of people, they put really too far on the forehead. They shouldn't be too far. On another token, they shouldn't be very close. So we're not gonna have a salt bridge. So let me work on this side. And again, people do prep differently. I like to do circumference. This is how I do. And then I put wires on the top of the head. Same technique is very useful and valuable with the small kids and with the combative patients. What I do the same circumference. I put the wires, then I use a gauze wrap. I wrap the head around, and these wires are secure. Then I put the rest on the top, and you could do very difficult patients. Otherwise, sometimes it's some of these patients cannot be performed. So this is closer. I probably see it from this end. So we are not doing it like in a So typically, in my environment where I am like full-time employed, it takes up to 1.5 hours to do the whole settings, including you put the head wrap, you move machine to the patient room, you adjust the machine, and you're ready to start. You resume recording actually at the bedside. It could be ICUs, it could be epilepsy monitoring rooms, which we have in our hospital. So pretty much. The other thing, which it's on a place where you work. You don't have to do it. What we do, we found more feasible to put a reference wire instead of here, to put it in between, a little bit larger space, and to avoid like a salt bridge, and that way, as long as everyone in EEG department knows where the reference wire, because sometimes the wires could be bad. You have to do like a troubleshooting. You need to know where the reference wire placed. So as long as you know all of this, you should be fine. So this is pretty much done with the head wrap, and I'll show you the next technique, which really will greatly save your time in terms of performance of the test, is how to apply the paste. So what we found is just if you use like 20 or 30 cc syringe and put a paste Elifix inside. This is only a type of paste which you could use on a long-term epilepsy monitoring and make reassurance that it's gonna last long, because if you're gonna put 10-20 paste, it's gonna be gone in 2-3 days. If you want to do longer than 3 days, then you need to use Elifix. So let me see, I'm pretty much done with this one. So this is like a syringe which I showed you. So, but I use some techniques. As I told you, we need to make sure that we're gonna prevent a forehead from a permanent marks, because what's gonna happen when you're gonna use a wrapping technique to secure the wires, then it's gonna be a problem. In a day or two, the metal gonna start to affect the skin, and in order to do it, you have to prevent it. So what we found is just if you take like 4x4, you wrap it like that, you put it on the patient head, and then you put it like right here, and then you apply 3 wires, so the plastic not gonna be against the forehead. That's the key. So this is specs for the FP1, FP2, and the ground wire which you place on the forehead. And the other thing which I want to emphasize is just type of wires which I use. I use slightly different ones. They're a little bit thicker. They're easy to maintain. So you could put them, and you could so they're not tangled, and they're easy to use. So it's gonna give you peace of mind. And so what you do, you put one right here.
So this sticking glue is
This is like a conductive paste.
oh,
This is conductive paste.
also
This
it's
is
not stick.
and this paste, what is good with this paste gonna stay for 2 weeks. In my experience, I mean we had even longer study, but 2 weeks I will guarantee you we will have no problems whatsoever
Yeah.
for 2
So
weeks.
we don't use that.
Right.
No, we use a 10-20 paste because we're not right now using anything longer than 72
Okay.
hours.
Right, but if you will consider to do it like really long-term epilepsy monitoring, this is the one which...
LFX is better because it doesn't break down.
Right. And then what, let me show you another supply which is really good. It's called Hyperfix. Hyperfix is just a tape. It's just a roll tape, and I cut it like in pieces already prepared for the presentation. This kind of like tape is good, and it's hyperallergic tape. It's breathable tape, so it's one of the best on the market too. So what you do, you place like half tape goes on a gauze, like on 4x4, and half goes on a patient head. So that way it's secure really good, this part. And what I do, I typically start to I start to set the most difficult wires first, and then the rest shouldn't be a problem. So the ones which goes on a patient non-hair parts I put with a hyperfix. On a hair part I'll put with the cotton squares. So the other technique how to use it and make secure that it's gonna stay for a really long time, you put one here on a patient, but this is not enough. Then you take a regular clear tape and you made it smaller. What you do a small anchor like this. That's prevent the wire to stay really good, and one you put on the top of that, and that's gonna be permanent. It's not gonna go anywhere. So this is how we do A1 and A2. So let me put the other one. It's gonna be same thing on another side. So you place the wire. Just take this one. Okay, and then I'm gonna take this one, put it under. Okay, and you put one on the top, and you well secured. So, and the rest are really easy and simple. All you have to do is take a syringe, squeeze, apply this one. And it's fast. You see, you save a lot of time. When you put like 10-20, you scoop each time, and you apply, and using a syringe, it saves you a lot of time. I just barely see it from this angle. Hopefully should be symmetrical.
This is what we are using in the sleep lab, no?
Halifax is the same, yeah.
Right. So, and for the rest of the wires, you use like a cotton squares. I mean, there is like a roll which I already pre-cut for the squares.
And we already have that.
Yeah. So, if you could help me just with it, so I'm gonna pull the wires. And with this wires is really, because they're slightly thicker than the others, it's much easier to manage them later on. So
What's the brand, Dimitri, of wires that you use? Are they Nicolay or?
I don't even remember from the top of my head. I mean, I can show you a catalog number after the presentation, so you can